Hi there. My name is Dr. Kimberly Ernest. I'm a licensed psychologist and licensed professional counselor in the state of Pennsylvania, the president of Pennsylvania Counseling Services, and the founder of Liveup Counseling. So, what is Liveup Counseling? Well, once upon a time, Pennsylvania Counseling Services, about 40 some odd years ago, was born as a private practice out of Roy Smith's basement. However, since that season, we have really transitioned both our services as well as our identity as a provider from private practice into a true community mental health model. We do all the different levels of care. So we have outpatient, psychiatry, drug and alcohol, mental health. We do forensic services for community reentry. We have IBHS, MST, FRP, family based, and every other level of alphabet soup known to mankind. Most of our services are provided through a medical assistance model. And what's lovely is that many of our providers are pre licensed and are able to do licensure supervision in pursuit of their broader clinical license. Unfortunately, what we've discovered is in recent years, however, where once upon a time providers used to achieve that license and stay in community mental health for a season, giving back, providing supervision, a lot of factors are leading individuals into moving into private practice more swiftly than ever before. Right now, Pennsylvania Counseling Services is doing just fine. We have plenty of supervisors, and we're truly able to meet the need of our pre-licensed providers. However, a few years ago, we were turning away an absurd amount of private insurances each week, sometimes to the tune of 200 clients per week. In May of 2023, we decided that we could probably address two different things if we were to return to our roots by starting a private practice program here at Pennsylvania Counseling Services, and therefore Liveup Counseling was born. Liveup Counseling is essentially a private practice in a box. It's similar to some of those more national brands, but with a local flavor, a local feel. Liveup Counseling, the legal designation, is simply Pennsylvania Counseling Services doing business as Liveup Counseling. And we put Liveup Counseling in a couple of our little private practice buildings that we had outgrown as community mental health providers. In those spaces, we gave up our medical assistance licenses, so Liveup Counseling providers can only take private insurances or private pay, and they're not allowed to take medical assistance. The good news is that with that, we also don't have some of the same regulations that medical assistance has in terms of clinical documentation and oversight. So we were able to pare down many of our clinical documentation models commensurate with the more private practice feel. Liveup Counseling providers are provided an EMR system. They're given space to a secure office at their local location. They have access to our healthy referral stream, and our clients are scheduled for them through patient registration. Our credentialing department works hard to get all of our Liveup Counseling providers credentialed with every insurance they're legally allowed to take. Our patient registration department takes the phone call or the message from that prospective client, gathers some of that initial information, verifies insurance, and then matches that prospective client with a provider who happens to be accepting in that space. We take care of your cleaning and snow removal for your private offices. We handle electronic medical requests. We also make sure that all of your needs, such as EMR being addressed, are navigated fully. Liveup Counseling is a 1099 based position, so it's not a W-2 or employment position. That means our providers have pretty much complete autonomy over their own independent practice. They determine what their age limits are and who they're willing to see. They decide what percentage of their work is hybrid, telehealth, from the office. They determine when they're taking new clients and where that availability may lie. They decide what their schedule is, how often they work. There's no minimums, there's no maximums. The expectations for our providers are that they see the client for the recommended amount, that they write the note, that they ensure the client pays their copays and maintains a credit card on file, and essentially does any of the client-facing pieces, like verifying insurance periodically to avoid future write-offs. Alternatively, Pennsylvania Counseling Services takes care of all those behind-the-scenes pieces for our Liveup Counseling providers. When it comes to out-of-pocket costs for our Liveup Counseling providers, we no longer have a subscription fee. We've done away from that. However, our Liveup Counseling providers are required to maintain their own independent liability insurance with PCS named as a certificate holder, as well as have a good phone number that patient registration can provide to prospective clients. Many of our clinicians use different options for that. So some use their own cell phone, others will get like a track phone, some will add a new line to their current phone product, and some even use a Google Voice number. There's probably a lot more options out there, but those are just to name a few. Finally, our Liveup Counseling providers also have some autonomy over whether or not they see pre-licensed supervisees through PA Counseling, which they simply invoice us for on their regular invoices each week. However, we also might have other Liveup Counseling providers that are in those initial stages of licensure or have those provisional licenses, such as an LSW. Pennsylvania Counseling Services is trying to keep costs low for our LSW Liveup Counseling providers that are seeking supervision. And so truly, we just provide you a list of other Liveup Counseling providers like LCSWs, LPCs, or LMFTs, and then you pay out of pocket directly to them. PCS doesn't take a cut. We allow y'all to negotiate that. And that's one way we keep costs down to create and keep reimbursement up for our licensed providers. We also give our licensed providers complete autonomy over their no-show fees and determinations. So we won't bill that on your behalf, but you can charge your clients their own cash, check, or even set up your own credit card option through something like Square or Bills.com and charge your clients for the no-show fee, of which you keep in its entirety. We have found giving clinicians autonomy over their own practice is one of the best ways to increase clinician satisfaction and create care that clients have in a more sustainable way. Our hope is that through Liveup Counseling, we are able to serve our extremely healthy referral stream and create an opportunity for many of our in-house providers that receive their licenses while at PA Counseling to have their next step of career in that private practice sector. We also allow access to our Liveup Counseling providers to our in-house prescribers so that they can improve that client care more fully. They have access to all of our CE programming so that they can get all their training and continuing education completely free of charge to them. And should the worst ever happen, they have access to our risk management team to ensure their clinical documentation and their license is ultimately protected. For more information about Liveup Counseling, please visit liveupcounseling.com or shoot an email to Kim at Liveup Counseling if you'd like to discuss potentially joining our team as a licensed credentialed provider. We are excited for the future of Liveup Counseling and what that may mean to our providers, our pre-licensed supervisees at PA Counseling, and ultimately the clients and communities we serve. Thank you.